Welcome everyone to NEET PG Predictor Series Part 1. As I always said that NEET PG is more of a superficial exam. So the number of repeated topics, I can't suggest that much. Though some topics are repeated, but it is a kind of superficial exam, and if you know the basics of all the subjects, then you can score well. Still then, I have picked out the most repeated topics in the PYQs or the PYQ topics of NEET PG in the past 7 to 8 years of NEET PG. So let's start. Firstly, coming to anatomy, as you know that the muscles of mastication is very much important. एंड इस बात तो क्वेश्चन आया था कि मुंह अगर खुला का खुला रह जाता है कौन सा मसल रिस्पॉन्सिबल है, लैटरल टेरिकॉइड. एंड आफ्टर दैट इज द muscles of larynx. Then is the great auricular nerve. The sensations in this part of the angle of mouth is asked. Brown-Sequard syndrome, important. Third and fourth ventricle also you can learn. Third ventricle is more important. Thalamus is important. The pharyngeal arches is very much important. See, which I have highlighted now, they are more important. They are more repeatedly asked. Paramesonephric, mesonephric, development of heart. The opening of diaphragm we remember by I ate 10 eggs at 12 p.m. So for I is IVC in the 8th segment in the T10, the esophagus and the vagus at is aorta and thoracic duct. So by this mnemonic you can easily remember, and this has been asked in many previous year questions. So you can easily crack this question by this mnemonic. Now the choanal segments of liver and the cantilenes line. The derivatives of median, medial and lateral umbilical ligament, Simpson fossa. Inguinal lymphatic drainage and the inguinal rings also, as it was asked. Portocaval anastomosis. Brachial plexus, first year topic, the first topic to be taught, and it is also most important for the NEET PG perspective. And the nerves and palsies, mainly the supex nerve and common peroneal nerve also is asked. And stripping of great saphenous vein below knee damages which nerve? And histology of types of epithelium and basics, means the basic identification you need to do in first year, only that is asked. Physiology, in physiology the glucose transporters, the glut and the SGLT2 are important. The action potential is asked many times. Cardiac muscle AP, action potential, JBP anomalies. It's a medicine perspective question also. Baroreceptor and vein bridge reflex. Compliance of lung, this time only it was asked. Lung volume and capacities from NEET UG days only you are reading that. Obstructive and restrictive lung diseases, VQ ratio, oxygen dissociation curve, the neurochemical control of respiration, decorticate and decerebrate rigidity, the basal ganglia lesions, areas of brains and clinical features, more for INICET I would say. Hypothalamus, the nucleus of hypothalamus and the regulations. Renal auto-regulation, the insulin-inulin curve, this was in the USMLE step 1 first aid also. Micturition, ENS, mechanism of action of hormones, ADH and related disorders. Sihan syndrome is sometimes asked, and impotence and caveolins. In biochemistry perspective, the enzymes regulated by the insulin and glucagon and the anabolic or catabolic steps, they are important. The fasting state, what all mechanisms are activated. Sphingolipidosis, all the disorders of inborn metabolism, it is important for maybe biochemistry also and maybe pediatrics also. What matters? The question matters and you answering matters. From which subject it is coming, it doesn't matter. So if you study the disorders of inborn metabolism, then it would be both helpful for your biochemistry and pediatrics. Biochemical tests like the Rothera test, the Vandenberg test, and all the glucose estimations tests like Selivanov, Benedict, these all are asked. Inhibitors of ETC is important. The HMP pathway, types of enzyme inhibition, aromatic amino acids, creatinine, carnitine, genetics, NADPH, vitamins, micronutrient deficiency like in acrodermatitis enteropathica. This was asked in 23 only this year. I made it wrong also. So microbiology perspective, the culture media staining, food poisoning, drug of choice of various bacterial infection, it is important, and it is important for your clinical practice also. That's why it is asked more. As I always say that NEET PG is more of a clinically oriented exam, means it tests your clinical sense, like what you are going to do in this situation, what you are going to do in this situation. Means they ask a new question, but from your clinical skills you can make out the answer. Now Clostridium difficile, commonly asked, diphtheria toxin, TB investigations, nocardiactinomyces, E. coli strains, cholera, scombird fish poisoning and UTI, satellitism, and the atypical ones, syphilis, leptospira, rickettsia, H. pylori, mycoplasma. In mycology, candida, dermatophytes are important. Talaromyces was asked once. Mucor, it's repeatedly asked after the COVID-19 pandemic. Now the frequency has reduced a bit. Cryptococcus, histoplasma, trichuris in the parasites, trichomonas, giardia. You can see all the list. In virus, parvovirus is very much important for INI aspect also, and the new evolving virus are also important now. The immunology, you can add monkeypox to it also. You can add, sometimes could be asked, but it's not that much severe or that much causing loss of life, so it is not asked much. Immunology, both immunology is present in microbiology and pathology, so from any one of the points you can read it. In pharmacology in general, the equations enzyme inducer and inhibitor, DRC, pregnancy category drugs, because when you practice clinically also you need to know the category of drugs and you need to prescribe according to that. In ANS, Botox receptors, BPH drugs, anti-glaucoma drugs are very much important. CVS, you can see all the drugs. In otacoids, the NSAIDs are repeatedly asked, the aspirin and the PCM most commonly. DMARDs, which are all the first line drugs for rheumatoid arthritis, biologics and prostaglandins. In antimicrobials is very much important, mainly the major side effects, the mechanism of action, and renal safety, and the pre-exposure, post-exposure prophylaxis of HIV is also very much important. Endocrine, in endocrine steroids, their doses in preterm labor, as you know, that the betamethasone and dexamethasone, it's commonly given and it's asked also commonly. Most important is the contraception and the anti-diabetic drugs. In CNS, clozapine is very much important. This year also it was asked about sialorrhea. In CNS, as I told, clozapine. In anti-cancer drugs, the targeted therapies are most commonly asked, and the common side effects of the well-known drugs are asked in NEET PG. And if you see INICET, only the targeted therapies. In hematology, the antiplatelet fibrinolytic drugs. In GIT, antiemetics and SINA was only asked. In respiratory, theophylline is commonly asked. Monoclonal antibodies you need to study by heart. If you want, I will share my notes of monoclonal antibodies also, or make a dedicated video on that. Diuretics, loop and potassium sparing diuretics. In mechanical, in FMT, coming to FMT, the injuries. So it's asked, though FMT there are not much repeated topics because it is just short subjects and only 8 questions are asked. Autopsy, types of organ removal was asked this year. in asphyxia, all types of asphyxial death, and the dry drowning, wet drowning, saltwater drowning, and the normal water drowning or the freshwater drowning. The mechanism how it causes death is important. Identification, gallstone charts, toxicology. Toxicology is very much important. This time snake bite was asked. See, I have highlighted the IPCs also, important, most important IPCs here that you need to know. And these are the IPCs. This time 316 IPC I think was asked, or 16 or 15 IPC was asked, or 13, I don't remember completely, but 12 to 16 is a series. You need to know all this, then only you can answer that. Now coming to pathology, firstly metaplasia of Barrett's was asked a particular time, many times. Necrosis, apoptosis, in detail you need to know what are the diagnostics test and all. Stable and labile tissue, it was asked in many years previous NEET PG exam. This is not a recent time exam. Now the newer things that are discovered, the pyroptosis, autophagy, these are asked. Pheroptosis. Now the lifespan means, I want to mean that the lifespan of human beings, the telomerase, and how the sirtuins act and how to increase the lifespan. Main is the glucose control, the reducing the amount of glucose, because glucose, as you know, that if glucose enters cell, then it activates IGF and it causes cell turnover. So to inhibit this, you should reduce the amount of glucose consumption only. Now the interleukins involved in pyrexia, bleeding disorder, trinucleotide repeats was asked sometimes. And the dysplasia, anaplasia, Warburg hypothesis, some of the important tumor suppressor genes and proto-oncogenes. This I would share in the pro pack. Those who have joined my channel, I would share in the pro pack group only the tumor suppression genes and proto-oncogenes that are important. So please remind me there, those who have joined. In hematology, all the cell markers, the CD4 markers, CD markers, you should remember, so that you can distinguish that which kind of malignancy it is. Now APML is asked most of the time because of the ATRA. ATRA is very much useful for APML. CML, as you know, it is the most commonly asked question, the Philadelphia chromosome. Langerhans histiocytosis. Hodgkin's is very much asked, and the types of Hodgkin's. And types of hemolytic anemia. Hereditary spherocytosis, it was asked this time. The sickle cell anemia, thalassemia, megaloblastic anemia, aplastic anemia, and pure red cell aplasia also I can add here. Now in systemic, the GCT, Takayasu arteritis, PAN, Kawasaki, the HSP, vegetations in heart, multiple, I'm sorry, it is mitral stenosis. So short forms do create confusion sometimes. The ARDS, alpha-1 antitrypsin deficiency, lung tumors, commonly asked. This time also it was asked regarding squamous cell cancer that causes hypercalcemia. Pneumoconiosis, achalasia cardia, celiac disease, and all you can see. The important is the inheritance pattern. So autosomal dominant, X-linked dominant, X-linked recessive, autosomal recessive, all, and mitochondrial inheritance. You need to know the examples. I can share it in the pro pack subscribers also. Thromboelastography, previous year it was asked, so there are chances that you need to study the thromboelastography and how to interpret it also you should know. So ये वाला था part 1. If you want part 2 also, our target is, wait, let me mention the target. Our target in this video is 250 plus likes. Do hit the target. Okay, now this regarding this PDF would be available not only in the pro pack but for others your target in this series is, because एक जन कहा था, intelligent one only, someone said that if you are good at something, you shouldn't do it for free. So I am also not doing it for free. I'm giving you a target which is free for you. So do the target completely. So in these 3 videos, our target is 1k likes. We would have another 2 parts, 1k likes, or in subscribers, 500 subscribers. If I cross with these 3 videos, then I would surely share the PDF in the main group. So do join my Telegram channel. And also I am available on Instagram. I post some medically relevant reels also, which can help you in studies in short format. So you can follow at the rate Dr. Mayukh Hazra in Instagram, okay, if you wish. So take care, bye bye, all the best.